So community water fluoridation offers an opportunity to provide fluorides to the population in a way that doesn't require the community to do anything particularly proactive or active about their use of fluorides. We know that the information available through research shows that we've got a population protection of between 20 and 40%, improvements in the levels of dental decay. And it's highly cost effective. In terms of delivering fluorides to a population, community water fluoridation is one of the most cost effective public health measures you can put in place. So I work in two different areas of the country, one which has community water fluoridation in place and one which does not have community water fluoridation in place. What I see as a difference is we do see lower levels of dental decay in the communities that have got community water fluoridation, but at an individual practitioner level I also see decay that's more aggressive and harder to treat in the community that doesn't have water fluoridation in place. And what that means is that for the children often that I'm treating, I have to take more teeth out and I have fewer options about what I can do for their dental care. So the confidence we have that community water fluoridation is an important part of keeping dental decay lower in New Zealand comes from different levels of information. In 2009, the New Zealand Ministry of Health published their latest oral health survey where they looked at children and adults across the country. And for children who were living in a fluoridated area of the country, the dental decay levels were 40% lower than for those children who were living in a non-fluoridated area. You then weigh that up with information that's available from local studies in New Zealand over the last 10 to 20 years and international studies, and both of those show overall that there are lower levels of dental decay for children and adults when they live in fluoridated water areas. If you add that information together with what we see as individual practitioners when we're working in fluoridated areas, lower levels of dental decay and decay that is easier to treat, overall you're left with an important impression that community water fluoridation is an important part of reducing dental decay levels across the country. If we remove water fluoridation, I think we're going to see higher levels of dental decay across the community. We're going to see harder to treat dental decay because as an individual practitioner I'm dealing with decay which is more aggressive, more difficult to manage. And at a population level we're going to see a bigger level of the population having dental decay which needs to be managed both for children by the public system and for adolescents and adults by dentists in practice. So severe levels of dental decay do still happen in New Zealand. If we look at children, around about half of 5-year-old children and half of our 12 and 13-year-old children have had some level of dental decay. Those children who've had decay will have been to see the dental therapist and had fillings placed, will have had teeth removed. And in 2009, 6,000 children were admitted to New Zealand hospitals to have dental treatment provided, mainly under general anaesthetic. Those children will have had teeth removed and fillings placed during those operations. We know that children who've had dental decay, that's one of the bigger risk factors for them developing future decay. And so by preventing decay early, we want to try and reduce that ongoing risk. The Dunedin multidisciplinary study, where they've been looking at children through into their adult years, has shown us that for the children who had dental decay in their baby teeth, there's an increased risk of those permanent teeth coming through with some sort of defect on the tooth. And so primary tooth decay has an ongoing effect into adult teeth, both in terms of risk of future dental decay and increasing the chances of having a developmental defect in the permanent teeth. One of the challenges of our modern diets is the frequency with which we consume refined sugars. Refined sugars around the teeth in combination with the bacteria that are on the teeth cause an acid, and that acid draws the mineral out of the tooth. And if that happens often enough, eventually more mineral comes out and we form a hole in the tooth. What water fluoridation and fluorides in general offer us is an ability to tip that balance back in favour of the tooth mineral returning to the tooth. And so community water fluoridation offers an ability to have low levels of fluoride around the tooth surface throughout the day, tipping the balance back in favour of repairing the tooth after acid challenges from sugary drinks and foods.